So let me introduce to you our first speaker. He is an epitome of successful provinciano. He doubled as a crew in a fast food chain during his student days until he finished his nursing course with honors and made his parents proud of his sterling performance in the nurse licensure examination. So his story of success represents the aspirations of today's nurses. So today he is co-listed with Bill Gates in the 25th edition of Marquis Who's Who in the World. So he is the first Filipino to write a test preparations guidebook for the world's leading health sciences publisher, Mosby Elsevier and the Jones and Portlet Publishers USA. He has over 25 years of teaching and administrative experience in test preparations, including graduate and undergraduate nursing programs. So he was named one of the Go Negocio's first 50 inspiring Filipino entrepreneurs and the Philippine Graphics Magazine's 2006 Young Leaders of the Philippines. So he received the MVP Bossing Award for Education, the Agora Award for Entrepreneurship from the Philippine Marketing Association, the SME IT Award for Innovation from the Philippine Internet Commerce Society, the 10 Outstanding Filipino Entrepreneurs from Entrepreneur Magazine, and the Young Market Master for Entrepreneurship from Mansmith and Fielders. So he is the first Filipino nurse entrepreneur to be accepted as a member of the prestigious Ernst and Young Entrepreneur for the Year Academy. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship. So he finished his Bachelor of Science in Nursing cum laude and Master of Arts in Nursing summa cum laude at University of Santo Tomas. So he was a board top notcher in the Philippine Nurse Licensure Examination, where he obtained a rating of 89.20. He obtained his post-baccalaureate certificate in e-learning design and Masters of Education in Learning, Design and Technology at the Pennsylvania State University, where he finished both courses with GPA of 4.0. He received his training on online facilitation at Harvard Graduate School of Education. So everyone, let us all welcome Sir Ray A. Gapuz. Hi, Sir
Pleasant good
Ray.
morning. Hello. Thank you very much for the very kind introduction and very long and comprehensive. And since that is all there is to it, let's go home. No, just kidding aside. Anyway, to our future colleagues who are here, brace yourselves as we engage in this teaching and learning session that would, I tell you, change the way how you think about tests and eventually would make you love taking tests the way I do it. Okay, so before we start, let me actually share with you this reminder. A copy of the slides for the presentation will be sent to your email after the webinar. Uy, may nagsabi, thank you Kim Bernal, ang cute ni Sir Ray. Bigyan ng libro. Sir Miko, bigyan ng libro. Padala natin ng libreng libro ito. Screenshot na natin yon. Paminsan-minsan lang ako napupuri because of actually medyo 50-50 na po yung gumupit sa akin. Okay. Tignan nyo naman, gagong gupit ako, di ba? Tanong nga sa akin ng isang kaibigan, pangit ka nagpagupit? Okay. Anyway. Hindi bakit ka nagpagupit pangit ka nagpagupit. Kasi pakiramdam ko sa gupit ko, ang laki-laki ng mukha ko. Anyway, pleasant morning to everyone, to those who want to top the board, to those who want to pass the board, and most importantly, to those who believe they can. Welcome to this masterclass sponsored by Health Carousel Philippines, a company that's really dedicated to the welfare of nurses. That's why I'm here. Ayan. So anyway, This is your mentor, Ray Gapuz, your fact check buddy, starting off our masterclass session today. So let's begin with an inspiration from the mail. Ano ba ang mga sinasabi ng ating mga previous participants? Ito po yon. Sabi ni P, Sir Gapuz, sobrang thank you talaga, halos lahat ng tinuro nyo dun sa lecture and yung pag-attack ng question sobrang sakto. I'm now a registered nurse and thanks also to you. More power, next ko na ang NCLEX. Wow! To receive such message coming from a participant is really something that inspires us to do more for our fellow nurses and our colleagues to be. Okay, ito naman kay Buboy, tinakpan ko po ang apelyido. Sir Ray, maraming salamat po una sa Panginoon at ako po ay nakapasa this last November. Pangalawa po sa inyo at ginamit kayo ni Lord instrumento para matulungan kami na maturuan ninyo. Sa totoo lang po, sa YouTube nyo lang po ako nanonood. Okay? So for those who don't know that I have a YouTube channel, ito po yung YouTube channel ko. I'll show it to you and so you'll have an idea. Ayan. If you would notice, okay, colleagues, we have NLE Quick Fix number 3 with Mentor Kai, NLE Quick Fix number 2 with Mentor Jem, and Quick Fix number 1 with me. Our most watched NLE video so far is actually how to pass and top the board. More than 30,000 views and counting. So those of you who have yet to subscribe, don't forget to subscribe and click that bell notification button so that you'll get notified when we upload updates, and we do that every week. Okay, so kailangan i-share din nyo sa inyong friends yan because you can request for the copy of the slides and sample questions in that YouTube channel. We don't mind giving it to you. Send us an email and we'll give you it. I will give you the slides, the copies of the sample questions and everything. So, sabi nito, nung nag-exam po ako last July, hindi po ako pinalad pero di po ako sumuko. Salamat po sa inyo kasi nag-a-upload kayo ng review na libre. Hindi po kasi ako makapag-review dahil sa trabaho ko. Wala po akong time. Sa gabi lang po, pag may bakante oras, nanonood ako sa YouTube channel nyo. Salamat po ulit. Sana marami pa kayong matulungan na katulad ko at humaba pa ang inyong buhay. At biglang may Merry Christmas. Okay. So, another thing, ito naman yung kay Mary Rose. I love reading the email of Mary Rose because she sent me an email when she first joined the masterclass last year. And then after, when the results came out, nagpadala pa rin siya ng email. Sir Ray, pumasa po ako sa exam. Umiiyak pa rin po ako sa tuwa ngayon, kundi po dahil sa gabay ninyo at sa mga free YouTube videos. Hindi ko po nakamit ang pinapangarap kong lisensya. After 12 years and after 2 failed takes, matatawag ko na rin ang sarili ko na ganap na nurse. Marami pong salamat sa inyo na way bigyan po kayo ng mahabang buhay at lakas para mas marami pa po kayong matulungan. To God be the glory. And then, siyempre, nagmamahal, nilagyan na nila RN yung pangalan niya. Mary Rose Ann I. Arsenal, RN. Wow! Okay. So, sana kayo na yung susunod. Yung naniniwalang sila na susunod, pakitype po sa chat box, I'm next. Go! Pakitype po sa chat box, I'm next. Ayan. Okay. Yung isa Tagalog na Tagalog, ako na ang susunod. Wala akong masabi. Okay. Now, ito favorite ko talaga. Ito yung favorite ko na email sa akin from Jimbo who wants to be a USRN, sent last March 21, 6:09 p.m. Ito sabi niya, Hi, Mentor Ray, blessed day. I would like to say and proud to say that I am USRN na po. Walang katumbas ang aking pasasalamat sa tulong nyo at especially your contents po sa YouTube. I am a low-budget nurse po na nangangarap maging USRN. Class, self-review po ako habang nagbabantay ng anak na 6 months old, trabaho, babysitter, at habang nagpapadede ng bata. Yan. Habang nagpapadede ng bata, pwede nagpapadede ng asawa, okay? At habang nagpapadede ng bata, nanonood po kami ng inyong YouTube. I bet. Paglaki ng anak niya, dahil nanonood na siya ng YouTube, baby pa lang siya. USRN din yan. Okay. Bata pa lang, sanggol pa lang, nanonood na kasama ng nanay. Sir Ray, malaking sakripisyo pero ang blessings ni God ay napakasarap at walang kasing sarap. Maraming salamat po uli, and to God be the glory in the name of our Lord Jesus Christ. Amen. And so, amen. That's Jimbo, USRN. See, habang nagpapadede ng anak, habang nanonood ng YouTube, sinamahan ng dasal. I know, class, sabi nga nila, God gives us what we want at the most appropriate time when we can best appreciate it. Iyan. So, tatandaan mo, umpisahan mo lang. Susunod na si Lord. Nandun siya mula umpisa hanggang huli. So, sa mga naniniwala, keep the faith. And remember this. Problems are not stop signs. They are guidelines. Okay? So, directional lahat yan. Lahat na nangyayari sa buhay, it's bringing you to the right direction. So, don't feel sad, don't feel bad when you don't get what you want. Ang importante, alam mong inumpisahan mo na. Diba? Para lang yung kantang, magsimula ka. Diba? Bati ng kay gandang umaga. Yan. Nang may ngiti. Huwag na natin patagalin. Ito na po ang ating quick fix functional concepts. Ano ba yung functional concepts na yan? Hindi ko po yan pinanaginipan. Yung functional concepts method is actually a product of a very lengthy research on pedagogies as well as on understanding Filipino or Eastern learners and integrating what they need into a new method or system. And I called it a functional concepts method, which is unique to the REA Gapuz test prep system. Okay. So, ito kasi ang passer's mindset. If magtitake ka ng exam, pwede ba tigil-tigilan mo? Ano yung mga bagay na kailangan tigil-tigilan? Yung pagbabasa ng ganito kakapal na libro. Okay? That's not the time to do that. The time to do that was when you are taking your bachelor's degree. At tigil-tigilan mo rin ang pagsusulat lang ng pagsusulat ng mga lectures. That's not the way to do it. Okay? You lose 50% of what you've written immediately after you've written it, if you have not done anything about it. So always remember, when you are reading, when you are writing down notes, you are just dealing with information, and information is not knowledge. You need to process that information, and to do that, you need a method. That's why, dapat ang question na tinatanong mo sa sarili mo kung gusto mong pumasa at mag-top ng board ay, given a question, what will I do? So, pag binigyan ako ng tanong, ano ang gagawin ko? That's the passer's mindset, okay? So, the main strategy, therefore, is to use functional concepts. Now, ano ba yung functional concepts? So, it could be a word, a phrase, a sentence, or even an entire paragraph that gives you a sense of direction as to what you should need to do given a specific scenario or a question. So, let me give you an example. Kunwari, pag nagbasa ka ng libro, di ba? Pagka alas 7 ng gabi, ganito pa yung position ng libro. Okay? Pagka mga alas 9 na ng gabi, nasa gilid na yan. Tumatagilid na rin yung ulo mo. Pag alas 10 na ng gabi, ginawa mo ng unan yung libro, di ba? Hoping to absorb the content by the process of diffusion. That's not gonna happen. Then eventually, nakatulog ka na habang nagmumuya, habang nananaginip, then nalawayan mo na yung libro mo, and paggising mo, only to find out, wala kang natandaan sa lahat ng binasa mo. Normal lang po yun. Huwag kang mag-alala, hindi ka nag-iisa, di ba? Huwag kang mag-alala. Ganon. May nagmamahal sa'yo. Nandito ako. Ganon. Okay. Anyway, so, anong gagawin, sir? Kasi sa dami-dami ng binasa mo, I bet wala kang naintindihan dyan kahit isa. Pare-pareho naman tayo nag-estudyante. Sa lahat ng sinulat natin, wala tayong nakita at natandaan kahit isa pagkatapos ng klase. Kundi, nagsulat lang tayo na nagsulat, namaga yung mga kamay natin, kinalyo na yung mga kamay natin. Tapos pag uwi mo ng bahay, pagod na pagod ka, sabi ng nanay mo, anak, magmerienda ka muna, parang pagod na pagod ka. Oo nga, mami. Ano bang ginawa nyo? Ang dami po namin diniscuss. O ano yung diniscuss nyo? Basta marami po. Wala ka natandaan kahit isa kasi information is not knowledge. Hindi naging knowledge yung mga sinulat mo. Sinulat mo lang siya for the sake na sinulat. Yun nga sinasabi ko ba't ka sulat na sulat? Pagdating ng exam, hindi ka naman magsusulat, kundi magsasagot ng tanong. That's the reason why the mindset should be, paano ako sumagot ng tanong? Okay? So for example, nagbasa ng pharma book na napakaraming mga sinasabi. Now, what do you need to do is to filter that. You use the functional concepts method. Okay? Focus on one sentence that says, lithium carbonate can potentially damage the kidneys. And create a functional concept. Lithium carbonate causes nephrotoxicity. Okay, so use that concept now if you are given a question on the test. For example, which one of the following laboratory data from a patient receiving lithium carbonate is most significant for the nurse to report to the healthcare provider? Now, ano gagawin mo? First, analyze. Sabi nga nila, if you cannot analyze, oralize. May ganun ba? Walang ganun na word. Okay. So anyway, so ALT is actually related to the liver. So 48 is normal units per liter. Normal is 7 to 55. So the concept is nephrotoxicity. So strike out natin letter A. It's about the liver. Serum potassium 4.2 milliequivalent per liter. That's normal. Normal is 3.5 to 5.3. And potassium is primarily excreted in the bowel and the bladder. So pwedeng hindi sa kidney. So we can strike that out. We're left with 2. Okay. BUN 35 milligrams per deciliter. Normal is 10 to 20. And your CK, creatinine kinase, the normal for creatinine kinase actually depends on the gender of the patient. For males, it's 39 to 308 units per liter. For female, it's usually 26 to 192 units per liter. Now, 1,250 units per ml could be elevated, but that is per ml, not per liter. Pay particular attention to this fact. And your CK is related to your heart. Okay, that's your CKMB, brain, CKBB, and musculoskeletal system. That's your CKMM. Now, question. The concept is dealing with nephrotoxicity. So which one has a special reference to the kidneys based on the options that we actually discussed? So it's actually your BUN. So the answer, therefore, is letter C. Why? The normal BUN level is 10 to 20 milligrams per deciliter, and an elevated level may indicate nephrotoxicity. So what we have here, 35 milligrams per deciliter is elevated. So therefore, aligned yung functional concept mo sa rational at saka sa sagot mo sa question. Ngayon ang tanong, sir, paano ko malalaman na sa dami ng binasa ko, yan pala yung sagot? You need the functional concepts method. So who determines the functional concepts method? Hindi mo problema yon. I determine the functional concepts method. Sir, paano ba na-determine yon? It's a process that me and my system alone knows. Given our more than 25 years as test preparation coaches in our company. So here we go. I hope with that example, meron kang idea ano ba ang functional concept. So here we go. Question, is the use of functional concepts effective? Hindi ko po sasagutin yan personally kasi di tayo magbubuhat ng bangko. Hayaan kong ang participants natin ang magsabi if it is effective. Sabi ni Gerald, oo sir, kasi yun agad iisipin kapag may symptoms na nakita. Basta kapag alam mo, functional concept, advance ang utak, nagpa-process agad. And here we go. What nurses are saying about the functional concepts method of the Gapuz NCLEX test prep system. Although this is NCLEX, if you may want to see it, sabi nila, my experience was exceptional. Sir Ray goes beyond and above of what is expected. Kudos to your team. 10,000 over 10, the best lecture na na-experience ko. I appreciate every bit from the start up to the end of the sessions. I love the humor of Sir Ray and how organized the team is. And the use of functional concepts of Dr. Ray made me understand clearer the topic. So, yan po ang mga feedback ng ating participants in our classes. So, huwag na natin patagalin. Let's try to apply functional concepts. Ready na ba kayo to learn and engage and to pass and top the board? Those who believe that they can, type yes on our chat box. Go! Tignan natin. Wow! Nangunguna si Clarissa. Tapos si Valerie, tapos si Kevin, tapos si Princess, si Roderick. Ang dami na. Pasensya na po. Hindi ko na. Biglang nag-flood. Bakit ganun pag may sumpa? Biglang nagfa-flood. Biglang nagfa-flood yung ating chat box. Okay? So, question, which concept do examiners find difficult to simplify? Ito lang yung problema na nagtitake ng exams eh. Hirap na hirap silang mag-simplify ng kanilang inaaral. Ang ginagawa nila, binabasa yung libro and then they end up sleeping after due to brain fatigue. Okay. Agree with me? Type yes if you agree with me na ang mahirap i-simplify, lalo na sa mga medyo matagal nang graduate at medyo mature na. Oh, okay, maglala, kasama ko dyan. Kasama ko sa mga medyo mature na. Okay, mga medyo mature na. Huwag matakot. Okay? research? Yes or no? Do you agree na medyo diyan kayo nahirapan? Ano sabi ni Kevin? True! Yung mga masyonders na daw, mga masyonda. Okay, 100% sir, agree. Okay, pagtawanan na lang natin yon. Sabi ba naman, one time I was flying in from another country back to the Philippines, bigla kasing tinatugtog dun sa PAL yung thunders, thunders, ganon. Sabi ko, naku, yan ang team song ng mga matatanda. I forgot, meron palang senior citizen sa harap ko. She turned to me, tumingin siya sa akin, sabi niya sa akin, tatanda ka rin. Sabi ko, ay pasensya na po, nagjo-joke lang po ako sa kasama ko. Okay. Ageism ba? Okay. But you know, class, age is just a number. Okay? Tama, sir, ang ginagawa, nasasagot ako ng mga Q&A para mahasa. Pero minsan, pag nagsasagot ng Q&A, ang ginagawa, babasahin yung question, tapos titignan na kagad yung answer, ay A. Babasahin ulit yung question, tapos titignan yung answer, ay B. Pagka ganun ang ginagawa mo, wala ding nangyayari. Kasi mechanical lang yung ginagawa mo. Okay? You are not reflecting on the questions, on the concepts, and on your manner of thinking. You have to know how to think about how you think. Diba? Yan tinatawag natin metacognitive ability. Okay? So, here we go. Here's a quick fix functional concept. Quantitative research involves numerical data. So, N. Quantitative numerical data. Pag sinabi natin quantitative research, we talk about numbers. So pag sinabi mo ngayong quantitative research, it is number-based. So which means it is an objective measurement. So the aim of the research involves the 3 C's. One is to classify the features. Second is to count, and third is to construct statistical models. And the most common type of data gathering technique for quantitative research will be structured interviews. So basta nakita mo yung number, yan, think quantitative. Think about the N in quantitative. And in the test, numerical data or number is usually reworded as, pay particular attention to these words, level, measure, number, degree, loss, or gain. Basta nakita mo yung word na level, measure, number, degree, loss, or gain. Think about quantitative research, okay? So here's an example. A study measuring nutrition and weight loss or gain in patients with anorexia nervosa. So you have the word measures, you have the word loss or gain. And take note, here's another quick fix functional concept. Qualitative research involves, take note, qualitative my L. So i-align natin, lived experiences. So this is about naturalistic inquiry. It's about in-depth understanding of a specific phenomenon. So therefore, to compare it with quantitative, ang quantitative, numerical or number-based. Ang qualitative, text-based. And it is focused on the why of things, okay? So which means this is a result of the direct experience of the subject. So the most common data gathering technique would be your focus group discussion. Now, when you see lived experiences, it could actually refer to descriptions, opinions, anecdotes, documents of those who are affected by the issue under study, okay? So, in the test, lived experiences can be denoted by words such as, remember, FRABs, feelings, reactions, anxiety, beliefs, stress. So pag nakita natin yan, feelings, reactions, anxiety, beliefs, stress. Pag nakita natin yan, think about qualitative research. Okay? Qualitative research. Okay? Here's an example. A study on the lived experience of healthcare workers during the pandemic. So lived experience, okay? So let's apply the functional concepts we just learned, okay? Here we go. Quantitative research involves numerical data. Which of the following is based on quantitative research? A, the effects of regular nurse visits to the patient's bedside on the number. Take note, quanti, my letter N, number, pasok sa banga. What about letter B? A study on the effects of white uniform of hospital personnel on pediatric patients. Nothing about the number. A study on benefits of preoperative health instructions to patients' feelings, we talk about it, quali. D, a study on the effects of touch on the patient's feelings of isolation. Feelings, we talk about quali. So the answer, a lot of you are answering in our chat box, excellent, that's letter A. So which means, natututo ka sa pinag-uusapan natin. Now let's take a look at another Example, which of the following studies is based on qualitative research? We said qualitative text-based, lived experiences, opinions, okay, based on the experiences of the subjects. A study measuring differences in blood pressure. These are about numbers before, during, and after procedure. B, a study examining patients' reactions. So kasama yun sa feelings, reactions, anxiety, beliefs, okay, to stress after open heart surgery. So pasok. Letter C, a study measuring, that's quantitative. Remember, you have weight loss and weight gain in patients with cancer. Letter D, a study examining oxygen levels, okay, for patients undergoing endotracheal suctioning. Therefore, the best answer is letter B. So class, are you getting the concepts I'm sharing with you? Kindly type yes or no. But let me tell you, just a warning, functional concepts is not a panacea. Hindi po yan cure-all for all the deficiencies, test-taking deficiencies that we have. Hindi ibig sabihin na ang functional concepts, lahat kayang sagutin ng functional concepts. No. There's no substitute for the knowledge which you built through the years. Okay? So, are you ready to learn some more? Yes? Okay. Loving the information, sabi ni Marvin Bravo, and learning. Okay? So, you want to learn some more? Here we go! Okay, salamat po at naintindihan nyo paano ako mag-explain. Maraming salamat. Here we go. Quick fix functional concept number 1. Okay, eto lang ha. Based on my observation, salamat po. Okay, sabi ni Katriza, ang galing, nasa Marawi siya, clear na clear. Sabi ni Heather, super thank you. Okay, don't forget this concept. What? Collaboration. Don't forget, collaboration. It entails working with the members of the multidisciplinary team. Ngayon, may tanong ako sa inyo. Kailangan sagutin nyo to kasi hindi ko alam kung paano ko ito papaliwanag pag di nyo ko sinagot. I want you to be honest. Alam nyo ba anong ibig sabihin ng multidisciplinary team? May idea ba kayo? Tell me yes or no. Come on. Tell me yes or no. Yung iba yes, yung iba no. Okay. Okay. So next na tanong ko. Alam nyo ba ano ang basihan ng mga miyembro ng multidisciplinary team? Yes or no? Come on. Yes or no? No na naman. Okay. Etymologically speaking, sabihin natin, kuhanin natin yung meaning from the word itself. Multi, ibig sabihin madami. Disciplinary, iba't ibang profesyon. So when you say multidisciplinary team, you have a team of professionals from different professions. Okay, let me give an example to be clear. For example, yung pasyente natin may acute glomerulonephritis. Anong organ ang affected doon? Kidneys. At dahil affected ang kidneys, nagre-retain siya ng fluids, kailangan i-modify ang diet. So, sinong team ang kailangan niya? Kailangan niya nephrologist kasi kidney yung affected eh. At dahil nag-retain siya ng fluids, kailangan niya ng dietary modification, kailangan niya ng registered dietitian. Class. The nutritionist, technically, is not considered a member of the multidisciplinary team. Why? By definition, the nutritionist is anyone who claims to know about food. So, wag mong lalagyan ng check ang nutritionist. It's always the registered dietitian. Yan ang recognized and acknowledged member of the team. Okay? So, take note, the nutritionist is, by definition, someone who knows about food, and anybody can claim to be a nutritionist. So it has to be the registered dietitian. Okay? Next important thing. Okay? So pag sinabi natin na merong edema, so you need a registered dietitian. Ang tanong, yun lang ba, sir? Nephrologist and registered dietitian? No. Tignan mo yung sequela or effect of treatment or complication ng sakit. For example, dahil nag-retain ng fluids, nagkaroon ng heart failure, di kailangan mo na ng cardiologist. Dahil nag-retain ng fluids, nagkaroon ng pulmonary edema, di kailangan mo na ng pulmonologist. So therefore, at the end of the question, pag ginawang select all that apply yan, ano ang kailangan mo in terms of the members of the multidisciplinary team? So kailangan mo ang nephrologist, ang registered dietitian, ang cardiologist, at ang pulmonologist. Okay? So lahat yon. But we're not saying na yun lang yung kailangan niya. So it would depend on the presented syndrome of the patient. Syndrome would be a group of signs and symptoms. Okay, now, there's a difference between multidisciplinary, interdisciplinary, and transdisciplinary. Ano ang difference? Let's first talk about the similarity. Lahat yun, kay multidisciplinary, interdisciplinary, and transdisciplinary, you have several members of professionals. Okay? Saan sila nagkaiba? On how they work. Okay? So, to be clear, take note, you don't have to copy this, you don't have to screenshot, we'll send you a copy of my slides. That's a promise we always do. Okay? So, in a multidisciplinary team, your professionals work separately. Okay? So, the cardiologist would work on the heart, the pulmonologist would work on the lungs, the nephrologist would work on the kidneys. In interdisciplinary, you involve the parents. So, parents plus the professionals, in which they initially work individually, and then that's followed by group discussion. So, mas improve na pag interdisciplinary. Individual, and then together as a group. And then transdisciplinary, you involve once again the parents and then the professionals. Now, how is transdisciplinary different from interdisciplinary? Sa interdisciplinary, the professionals work individually. Sa transdisciplinary, the professional works interactively and integrated from start to finish. So transdisciplinary approach, mula umpisa hanggang dulo, magkakasama yung members ng team to discuss the patient's condition, specifically the treatment plan. So nakuha natin ang difference, kasama ang parents sa interdisciplinary and transdisciplinary. Sa multidisciplinary, you just have the professionals. Sa multidisciplinary, the professional works independently. Sa interdisciplinary, initially the professionals work independently, followed by group discussions. In transdisciplinary, the professionals work together as a group from start to finish. Okay? So this is how we should be doing our analysis. We have to compare one from the other, note the similarities and differences, and then extract functional concepts. So let's have an example. Which among the members of the multidisciplinary team will the nurse would most likely collaborate with when a psychiatric patient is at risk for impaired gait? Okay, here we go. The main problem here is impaired gait. A podiatrist is a professional, a doctor of podiatry, not a doctor of medicine, a doctor of podiatry specializing in foot care. So it's just about the feet. It's not about the gait or the walking. Now, what's the difference between a physical therapist and an occupational therapist? For example, if you have a patient in traction and the patient is unable to walk and the patient is having pain, refer that person to the physical therapist. If the person has rheumatoid arthritis, they have ulnar drift and swan neck deformity, so their fingers are incapacitated, so they are unable to perform activities of daily living. If the focus is on fine motor skills, then you refer that patient to the occupational therapies, including patients with cognitive and learning disabilities. Therefore, to summarize, pag ang problema ng pasyente, gross motor, turning in bed, walking, physical therapist. Pati yung nakatraction na may pain, PT yan. Pag ang problema ng pasyente, fine motor, pagbukas ng doorknob, pagbukas ng baso, okay? Cognitive skills, learning abilities, okay? Katulad ng may rheumatoid arthritis, hindi makatake care ng sarili niya kasi incapacitated ang finger. So therefore, you refer that to the occupational therapist, okay? Now, the speech therapist is for the person with problems related to dysphagia or slurred speech post-CVA. And as we said, hindi kasama nutritionist. So the best answer is letter B. Okay, class, are you learning as of this point? Yes or no? Come on. Yes or no? Yes. Okay, so let's move on. Some more. A podiatrist is a professional devoted to the treatment of disorders of the foot, the ankle, and related structures of the leg. Okay? So here we go. When a patient begins phenytoin sodium or dilantin therapy. Now, phenytoin sodium is an anticonvulsant. One of the common adverse effects would be measles-like rash, which could be indicative of Stevens-Johnson syndrome. Now, the danger with Stevens-Johnson syndrome is that it causes corneal scarring and then eventually it leads to blindness. Now, if you talk about, listen class, if we talk about dilantin, don't forget, it may potentially cause gingival hyperplasia. So, nagiging taong puro gilagid. Therefore, pwede ba siya mag-toothbrush? Pwede, but soft bristle. Okay? They also need to be told to massage the gums, and so therefore, they have to visit, definitely, correct kayo dyan, the dentist. Sino naman ang nagsagot ng gynecologist? Bakit? Yung gilagid mo, ipapakita mo ba yan sa OP-Gyne? Siyempre hindi. Alangan naman sa carpenter, bakit pababawasan mo sa carpentero yung gilagid mo? Nakita ka ng taong puro gilagid. Okay, now. Okay, pay particular attention, class. So pag sinabi nating members of the multidisciplinary team, they are the referral professionals for specific concerns of the patient. So let's move on. Here's quick fix functional concept number 2. Herbal remedies may worsen bleeding in patients taking anticoagulants. So the trend nowadays is not just the local herbal remedies, mga pansitan, ulasimang bato, nyug-nyugan, jug-jug. Huwag mo kong pagturuin na CHN. Ayoko. Okay? Now, the trend is towards international herbal remedies. Like, for example, the herbal remedies that should not be taken by patients who are pre-op 10 days before the surgery because this could potentially worsen bleeding. Example would be CGGGG. So, chamomile, okay, which is a sedative, an herbal sedative. Your ginkgo, which is a blood thinner for patients with Alzheimer's disease, may worsen bleeding. Ginger, okay, garlic, di ba? That worsens bleeding when combined with anticoagulants. Garlic, okay, luya. Yung mga hindi pa po nakakita ng garlic, okay, pakitanggal po ang sapatos nyo. Makikita nyo po ang example ng garlic na minsan pinapa-pedicure nyo, okay? And then, of course, your ginseng. Okay, now, these herbal remedies should not be given to patients at least 10 days before surgery. Here we go, okay? So a patient has been scheduled for surgery. Which of the following data in the patient's history needs further evaluation from the nurse? So needs further evaluation. Pay particular attention to that phrase. Ibig sabihin, kailangan mong i-check. Okay? Because it could adversely affect the patient's condition. Okay? Pay particular attention. Okay? Class, o yan, sabi nga, the walking encyclopedia daw with a sense of humor. Salamat for the compliment. Aspirin intake for rheumatoid arthritis, yes. Okay? So aspirin can potentially worsen bleeding when it's combined with herbal remedies. Okay, so we put a check. Regular use of garlic at meal times, yes. So we said a while back that garlic could potentially cause bleeding. Use of ginkgo biloba as a food supplement, yes, especially those who don't want to have Alzheimer's. So that could potentially worsen bleeding because ginkgo thins the blood. And then height of 5 feet 4 inches, it doesn't have anything to do with the patient's surgery. So we put an X, no relevance at all. Cyst excision, this is already a scar on the forearm. So that there's no direct link between the scar and the patient's surgery. So, therefore, the answers are A, B, C. Okay, salamat po sa mga sumasabay sa aking mag-analyze. So, let's move on. Quick fix functional concept number 3. Let's talk about delegation. So, do not delegate any part of the nursing process, anything that requires decision-making, and you do not delegate ATE, assessment, teaching, and evaluation. Now, before we can differentiate delegation from assignment, take note, class, I'd like you to remember this specific concept, especially for nursing practice test 1 and test 2. Now, when we talk about delegation, how is it different from assignment? We first have to understand two terminologies, and that includes the words responsibility and accountability. So responsibility involves the performance of one's duties. So tanda mo, responsibility, duties. Accountability refers to the answerability for the outcome of one's duties. Accountability means sino ang mananagot. Okay? Ikaw ba na gumawa ng duty? It depends on whether you are performing delegation or assignment. So here we go. When you say delegation, you just transfer the responsibility. Iniutos mo, kunwari, sa unlicensed assistive personnel. Okay? Or your nursing attendant. Okay? Inuutos mo yung pag-take ng vital sign. Ngayon, after niya mag-take ng vital sign, nakalimutan niyang erase yung side rails, nahulog si pasyente. Okay? Sino ang may responsibilidad na pag-raise ng side rails? Yung attendant. Pero kaninong accountability yon? Doon sa nag-utos. Sino nag-utos? Yung RN. So in delegation, the accountability remains with the registered nurse. Okay, now let's compare that with assignment. When you say assignment, it's a transfer of both responsibility and accountability. O, sinabi mo dun sa nursing attendant na siya ang mag-take ng vital signs ng pasyente. Okay? Nag-take siya ng vital signs. Again, hindi na niya na-erase yung side rail. So, sinabi mo sa staff nurse mo na dapat yung staff nurse mag-follow up. Sinong may responsibility doon? So, yung staff nurse na. Okay? So when you assign a patient, you transfer both the responsibility and the accountability. So that's the difference. In delegation, the accountability remains with the RN. In assignment, you transfer both accountability and responsibility to whom you assigned the patient. Okay? Class, did I make myself clear with regard to the difference between delegation and assignment? Yes or no? Excellent. Okay, so let's move on. Which of the following activities can the nurse delegate to the unlicensed assisted personnel? Ano daw ang pwedeng i-delegate? Taking routine vital signs, the keyword is routine, yes. Pero ang initial vital signs, lalo na during admission at discharge, dapat sa RN lang yan. Okay? Baseline assessment yan eh. Administering heparin, now this is a high-risk medication together with your chemotherapeutic agent. Only an RN should do this. Do not delegate this. Okay? Administering insulin subcutaneously in a home care patient. Take note class, yung pag-administer ng insulin, kahit nga pasyente, pwede niyang gawin yan eh. So pag ang setting, home care, kahit na pareho lang na sub-Q ang heparin at insulin, yung insulin pwedeng i-delegate kung ang setting, home care. So, we put a check. Now, take note class. We said a while back that you cannot delegate any part of the nursing process. So assessment, planning, intervention, evaluation, outcomes determination, okay? So evaluating, that's a keyword. That's a part of the nursing process. You cannot delegate that. That's exclusively an RN's job. And then ensuring that the patient's bed is in low position, you can delegate it. In fact, this is one of the 5 important tasks that should be done by all members of the health team taking care of the patient to prevent falls, okay? So the answers are A, C, and E. Correct, okay? Ang dami-daming mga nagsasagot kasabay ko. Okay, yung susunod. Quick fix functional concept number 4. Okay? Remember this class. Drooling, ayan, drooling in a patient with neuromuscular disorder increases the risk for aspiration. Ano daw ba yung drooling? Dalawa tingin. Hindi, duling yon. Hindi. Drooling, iba yun. Excessive salivation, di ba? Okay. So, what do you imagine that comes to your mind pag may drooling? Well, it could be the look of your jowa on the evening of your honeymoon. So, if the jowa drools during honeymoon, gandang-ganda siya sa'yo. But if the jowa looks around and turns off the light during honeymoon, umasa ka pa. Okay. Okay, joke lang po yun. Kayo naman. Okay, kaya nga sinasabi ko pag ako naging mambabatas ng bansang ito, ang unang-unang batas ko, dapat ang marriage contract ay merong expiration date. Para pag yung pinakasalan mo pumangit, hindi nalagaan ang sarili, wag mo nang i-renew. Pag nalosyang na, sabihin mo, expired na, move on na tayo. O di wala kang problema sa annulment, wala kang problema sa divorce. Lahat naman ng kontrata kasi may expiration date. Ewan ko ba kung bakit naman yung marriage contract walang expiration, di ba? Isa pang dokumentong nakakatuwa minsan. May mga taong gusto magpagawa ng affidavit of loss. Pag tinanong mo, anong affidavit, ano ba ang nawala? Sabi niya, yung virginity ko po. Pwede mo bang mapagawa ng affidavit of loss of virginity? Hindi naman po pwede yun, di ba? Anong gagawin? Those are decisions that you make in life class that you just have to deal with it. Nagawa mo na na-desisyonan mo na, isinuko mo na ang batan, wala tayong magagawa doon, okay? So balik tayo sa functional concept natin. Aray ko. O may nakarelate, sabi ni Nicolette, sana daw makapalit na lang lagi ng asawa. Okay, ikaw mahilig ka sa chowking, laureate. Kasalanan daw ng drooling ito. Bakit ba tayo napunta dito sa pinag-uusapan na drooling? Okay, so let's move on, class. Drooling in a patient with neuromuscular disorder increases the risk for aspiration. So which means, pwede siyang mabilaukan. Okay? Okay. Now, the question is, sino-sino ba usually yung may drooling? Patients na may drooling are those patients with impairment of cranial nerve 9. That's your glossopharyngeal nerve, which is a mixed nerve. Okay, the sensory root is responsible for the sense of taste, and the motor root is responsible for swallowing and salivation. So take note, glossopharyngeal nerve, kung hindi mo na master ang cranial nerves mo, I have a simplified It's one of the most viewed videos on my YouTube channel with more than 24,000 views. Cranial nerve assessment that is simplified. So, sino-sino ba yung may mga drooling? Yung may multiple sclerosis, pwede magkaroon ng drooling yan. Remember, multiple sclerosis, you have demyelination of nerve fibers in the central nervous system, meaning the brain and the spinal cord. Okay? And take note, pag sinabi nating multiple sclerosis, ang goal of treatment dyan is to decrease nerve inflammation. So, what do they give? Your corticosteroid. Okay? Ngayon, may bago na silang treatment dyan. Yung parang ginagamit sa mga na-COVID na pasyente, yung monoclonal antibody. Sa mga na-COVID, yung tocilizumab yung binibigay. Pero sa multiple sclerosis, okay, ang binibigay yung ocrelizumab. Okay? So, yun lang yung FDA-approved na disease-modifying agent for multiple sclerosis. So, ano pa? Sino pa ang may drooling? Yung merong, take note of this class, amyotrophic lateral sclerosis. Now, what happens in ALS? In ALS, 5 to 10% could be genetic, autosomal dominant, so which means it could be transmitted in both males and females. 90%, the cause is unknown. Some believe that it could be due to environmental factors. Remember, ALS, activities related to military work. So hindi nila maintindihan bakit majority ng mga na-assign sa military eventually nagkakaroon ng amyotrophic lateral disease or Lou Gehrig's disease. Then L, exposure to lead. Okay? So, chemical imbalance that affects the brain. And then S, smoking. So ALS, activities related to military exposure, lead, and then smoking could potentially contribute to the development of amyotrophic lateral sclerosis. Now, your ALS may have the same symptoms as that of your MS. So the patient could have slurred speech, the patient could have difficulty swallowing, pareho silang may drooling. The difference is, in multiple sclerosis, there's usually bowel and bladder incontinence. Minsan, hindi na nakakaabot sa CR, umiihi na sa salawal, tumatain na sa salawal, yung may multiple sclerosis. Pero yung may ALS, that's not present. Wala silang incontinence. But all the other symptoms could be present in both, including slurred speech and excessive salivation or drooling. Now, kung may specific treatment ang multiple sclerosis, meron din sa amyotrophic lateral sclerosis, and that's your riluzole. Okay? The treatment, riluzole, will not reverse the symptoms of amyotrophic lateral sclerosis. It will just prolong the patient's life. Now, take note, multiple sclerosis and amyotrophic lateral sclerosis are treatable, but there are no specific cures. Okay? So, walang specific na cure. Meron lang nag-i-improve ng symptoms. Okay? So, even patients with Parkinson's disease, okay, pag sinabi natin Parkinson's disease, the midbrain is affected, the substantia nigra now will have decreased secretion of dopamine. Yun bang may Parkinson, pwede bang kumain ng chocolate? Yes, because chocolate increases the secretion of dopamine, which is deficient in patients with Parkinson's. Yung bang may Parkinson's, pwedeng mag-bike? Yes. Kasi biking improves their balance. In fact, it's now part of the rehabilitation activities of the Parkinson patient. Yung bang may Parkinson, dapat ba flat ang shoes? No. Dapat low-heeled ang shoes because they have a tendency to fall backwards. That's termed retropulsion. Therefore, to prevent retropulsion, you have to provide them low-heeled shoes. Yung mga 2 to 3 inches yung heels to prevent falling backwards. So, these are patient issues that you need to cover and you need to reflect on while you are studying disease conditions. Huwag kayong masyado nakafocus sa pathophysiology, memorizing signs and symptoms, diagnostic test treatment. That's not the trend in international testing. What matters now is that you know how to reflect, how to laymanize those medical terms that you are learning. Because at the end of the day, that's what matters. You have to be pragmatic. You have to be practical. You have to know what to use in terms of the things, the voluminous things that you've learned and memorized. You have to be able to transform information to workable knowledge that you can use to answer questions on the test. Okay? So let's move on to quick fix functional concept number 4, sample questions. Here we go. A patient with Parkinson's disease should be assessed for which manifestation of a complication? Once again, class, I'd like you to answer this for me, please. Dapat alam mo to. Is it coriform movement, drooling, thrombophlebitis, or elation? Go. Excellent. Yan, pinag-usapan natin drooling. Now look, here's the magic of functional concepts, class. Here's the magic. What if I change Parkinson's disease into something else? Okay? So instead of Parkinson's disease, multiple sclerosis na ngayon. Ano ang sagot mo? Related pa rin ba sa drooling? Give me an answer, class. What's your answer? What's your answer now? Excellent. Risk for aspiration. Okay, risk for aspiration. AAA. In early stage multiple sclerosis, just like in ALS, there's no pain initially. Wala pa pong pain sa early stage ng multiple sclerosis. Okay? Let's move on. So take note, kahit pinalitan yung diagnosis, drooling related pa rin ang sagot mo. Risk for aspiration. Beauty of functional concept. Next. Pangatlo, which symptom would need further evaluation in a patient with amyotrophic lateral sclerosis? Take note, class. Hindi na sa multiple sclerosis, hindi na sa Parkinson's disease, ALS na siya. So ano pa rin ang sagot natin? Give me an answer. Go. Excellent. Drooling. See? You have one functional concept and you were able to answer 3 different questions with confidence and you did it correctly. You got the correct answer. That's the beauty of using functional concepts. That's a system that's nowhere to be found in the rest of the world. Proudly Filipino made by yours truly. Okay, so let's move on. Okay, so quick fix functional concept number 5. Unusual findings in children require further evaluation from the nurse. So this requires a lot of assessment skills on your end. You have to be able to know how to assess the patient. Okay, here we go. Okay, what are unusual occurrences in infants and children? When there is salty skin, suspect cystic fibrosis. Some children will pronounce this cystic fibrosis because they don't know how to pronounce cystic fibrosis. Now, what's the main problem in cystic fibrosis? There's usually a production of thick mucus plug that could even prevent the reabsorption of sodium that comes out in the sweat. So normally kasi pag tayo pinagpawisan, yung sodium minsan nare-reabsorb ng skin. In patients with cystic fibrosis, what happens? The skin becomes salty because salt accumulates. It's not reabsorbed on the skin. Therefore, what the mother would say is, my baby tastes salty. Ibig sabihin, may cystic fibrosis. Pero pag sinabi ng nanay, my husband tastes salty, nag-jogging si hubby. Okay, so a complication of cystic fibrosis could be infertility and difficulty conceiving. Nahihirapang magkaanak. Once again, there is a genetic basis for this condition. There's a 25% chance for each children to have the disease and 50% chance to carry the trait if the parents both are trait carriers for cystic fibrosis. So they need to be referred to a geneticist. Next, bleeding after circumcision. This indicates hemophilia. Now, ideally, circumcision is done within the first week of birth. However, the position of the American Academy of Pediatrics is that circumcision is not essential for maintenance of health. Therefore, parents don't have the right to provide proxy consent for routine circumcision. Ibig sabihin, hindi pwedeng magbigay ng proxy consent ang magulang for non-therapeutic circumcision. So may therapeutic circumcision po ba? O, pag may phimosis yung bata, masyadong mahigpit yung foreskin. So masakit yon, that's why they have to circumcise the child. However, pag may epispedia yan, ibig sabihin urethral opening on the dorsal part of the genital, or hypospedia, urethral opening on the ventral part of the genital, circumcision is delayed because they need to use the skin to reconstruct the defect in these patients. However, class, in hemophilia, once circumcision is done, there's excessive bleeding. Okay? And this could be related to hemophilia type A, which is the absence of factor 8, or hemophilia type B, okay, which is the absence of factor 9, or otherwise known as Christmas factor. So hemophilia type B, the second most common, is known as Christmas disease. It's not named after the Christmas season. It was named after the boy, Stephen Christmas, who was initially diagnosed to not have the Christmas factor, or your factor number 9, okay? Now, what usually is done in patients with hemophilia? So this is transmitted from the mother to the son. So X-link yan, mother to son. So which means they need to be educated, so refer them to a geneticist. Okay, now, are there presently treatments? Yes. So one drug that is given in diabetes insipidus, either IV or intranasally, is your desmopressin. Your desmopressin increases clotting factor. So it stimulates the production of clotting factor, so we can give desmopressin. The second one is actually your emicizumab. Okay, so your emicizumab prevents bleeding in patients with hemophilia. Now, sabi natin, hemophilia is genetic. question, meron bang acquired hemophilia? Nung panahon ko, hindi tinuro sa amin. Pero nowadays, recent evidence suggests na merong acquired hemophilia. And it could be related to autoimmune diseases like multiple sclerosis. It could be related to pregnancy. It could be related to cancer or even the use of drugs. So which means hindi lang genetically transmitted ang hemophilia. So remember that the hallmark sign of hemophilia is hemarthrosis, bleeding in between joints. And pag ginawang satayan, what joints are affected? The wrists, the elbows, the knees, the ankles, the aunties, the lola, the joke lang. The knees and the ankles, okay? So if you see children na naka-wrap around yung wrist, yung elbows, yung knees, and yung ankles, think about hemophilia. Okay, you need to refer them to a geneticist. Next, apnea of more than 20 seconds is indicative of apnea of infancy. This is treated with either theophylline or the administration of caffeine. Pag less than 20 seconds ang apnea, this is expected because of the immature respiratory system of the infant, okay? And then when you have an extragluteal fold, you have your Trendelenburg sign, pelvic dropping, okay? You have your Galeazzi sign or your Alice sign, the presence of a click on abduction of the legs of the child. Then you have developmental dysplasia of the hips or congenital hip dislocation. Now, this is usually treated conservatively with double or triple diaper. If it doesn't improve, then they would use public harness to keep the legs in abduction for a couple of months, usually 2 to 3 months. And if that doesn't improve, then they may use hip spica cast. Okay. Next, current jelly stools. Current jelly is a mixture of mucoid and blood. And this is found in patients with intussusception, in which you have telescoping of the intestines, and this would give rise to the presence of sausage-shaped mass on palpation of the abdomen. And Dan's sign is the empty part of the intestines that comes after the sausage-shaped mass. So what could improve the symptom of intussusception? That's your barium enema. So barium enema is both diagnostic and therapeutic, because with the infusion of the enema into the colon, okay, it could actually stretch out the intestines and therefore will improve on the telescope area. And jaundice in the first 24 hours after delivery is indicative of your pathologic jaundice, which means there is RBC destruction kahit in utero pa lang. If the jaundice occurs after 24 hours, that's physiologic jaundice, that's expected. It would last for less than 2 weeks. If the jaundice persists for more than 2 weeks, that would mean biliary atresia. So in a patient with jaundice, it's very important to put them in a phototherapy and pay particular attention to the fact that you have to continuously feed the child while undergoing phototherapy, because your phototherapy could potentially cause diarrhea in the child. Okay, so you have to continue feeding the child. And large tongue, ay, ang masaya yung maging jowa daw yan, large tongue. Okay, Down syndrome or trisomy 21. Now, sometimes Down syndrome comes with mental retardation, so you need to refer them to a special education professional. That should be one of the members of the multidisciplinary team that should take care of a patient with Down syndrome. And large head could be associated with hydrocephalus. The normal head circumference should be 33 to 35 centimeters. If it goes beyond that, suspect hydrocephalus. Take note, the head circumference should be measured until the child is age 3. So sometimes there are associated conditions like Arnold-Chiari malformation or Dandy-Walker syndrome that leads to hydrocephalus. Pag nakita nyo yan sa exam, it was given several years back. Arnold-Chiari malformation or Dandy-Walker syndrome, just think about hydrocephalus. Your priority is to monitor the head circumference, okay? Oh, may mga mahilig dyan mag-monitor ng head circumference ng jowa. Okay, next, no spoken words by 16 months. Okay, think about autism spectrum disorder. Now, kailan ba dapat magsalita ang bata? 9 to 10 months. And the first word should be mama. The child would say mama non-specifically. What does that mean? The child would call the mother mama and would also call the father mama. So, if yung father nag-react at sinabing, paano nalaman ako na mama ako? Confirmed, okay? At sino naka-confirm? Yung 9 to 10-month-old na bata. Therefore, class, okay? Sino ang dapat mong unang-unang tignan pag ang pasyente hindi nakakapagsalita? Okay. Or ano ang dapat unang-unang mong tignan? Tignan mo yung other symptoms. Meron ba siyang eye contact? Okay? Cuddly ba siya? Kasi kung hindi, these are red flags for potential diagnosis of autism spectrum disorder. Okay? So remember, this is your mentor Ray saying there's no substitute for knowledge that you gained from what you learned. And information is not knowledge. And if I may add, if you do your best, you will definitely pass the test. So for your questions, I'm going to answer them after our session with Dr. Arquiza. Let me share with you first an inspirational story. Remember, you must not quit, okay? When things go wrong, as it sometimes will, when the road you're trudging seems all uphill, when the funds are low and the debts are high, naku, marami nakaka-relate dyan ngayon, and you want to smile but you have to sigh. When care is pressing you down a bit, rest if you must, but don't you quit. Life is queer with its twists and turns, as every one of us sometimes learns. And many a failure turns about when they might have won had they stuck it out. So don't give up, although the pace seems slow, you may succeed with another blow. Success is failure turned inside out, the silver tint out of the clouds of doubt. And you never can tell how close you are. It may be near when it seems so far. So stick to the fight when your heart is hit. It's when things seem worse that you must not quit. Everybody who believes that they will pass and top the board, type that phrase, I must not quit, on our chat box. Come on, everybody. I must not quit. So remember, problems are not stop signs. They are guidelines. So view everything that happens in your life as a sort of a sense of direction. So it is directional from up above. So my final word to everyone, you must not quit. This is your mentor, your fact check buddy Ray Gapuz, saying thank you. I'll see you in the Q&A session after Dr. Arquiza's talk. Maraming pong salamat sa inyong oras at pagsama sa amin ngayong araw na ito, na ipapangako ko namin, ibibigay namin ang aming makakaya para matulungan kayong pumasa sa inyong exam. Salamat po.